The healthcare crisis in this country is getting worse.
The U.S. has the world's most expensive healthcare system.
We are on track to spend more than $70 trillion on healthcare over the next decade.
2 different gynecologists, a dermatologist at some point for some reason, and I've racked up, I think, over $1,000 in medical debt at this point.
This was just a visit. There was no procedures done. They took my blood pressure.
When I saw the termination notice come in, it was kind of nerve-wracking. I was paying last year $57 a month premium, and then it jumped up this year to $16.90 a month.
Imagine getting sick and being scared of the bill more than the illness itself. That's the reality for millions of Americans right now. In the U.S., one hospital visit can cost thousands of dollars, even with insurance. So why is healthcare in America so expensive? America spends more on healthcare than almost any country in the world. Yet millions of people still struggle to afford basic treatment. People delay doctor visits, skip medication, and some even fall into debt just from getting sick. So what's actually going on? A lot of people think if you have insurance, you're safe. But in America, that's not always true. Even insured patients still pay. Monthly premiums, deductibles, copays, surprise medical bills, and healthcare costs keep rising. Some reports predict medical costs in the U.S. could rise nearly 10% again in 2026. That's why many Americans feel like healthcare is becoming impossible to afford. Now here's the scary part. Medical debt is exploding in America. Around 100 million Americans are dealing with medical debt right now. Some people owe hundreds, others owe thousands, just because they needed treatment. And many families are cutting back on food, utilities, and daily essentials just to pay healthcare bills. Imagine choosing between medicine or groceries. So why is healthcare so expensive? There isn't just one reason. It's a mix of expensive insurance systems, high drug prices, hospital costs, billing complexity, and administrative fees. America's healthcare system is extremely complicated compared to many countries. Even simple treatments can generate massive bills because multiple companies and providers are involved. And sometimes, patients don't even know the final price until after treatment because healthcare is so expensive. Many people avoid going to the doctor completely. Studies show medical debt is strongly linked to delayed healthcare and skipped treatment. People wait longer, problems get worse, and eventually, treatment becomes even more expensive. It becomes a cycle. What makes the situation even crazier? America spends far more on healthcare per person than many other developed countries. But despite the massive spending, many Americans still struggle with affordability and access. That's why healthcare has become one of the biggest financial fears in the country today.
Just so you understand, we could eliminate all the medical debt in the whole country for $2.5 billion. Now, we're at a high school, so we're going to do some math. We could abolish the medical debt in this country 10 times over for what we spent on a war we should have never fought. And I really wish people asked, General, how the hell are you going to pay for that? It turns out the way they're going to pay for that is to make sure that we never get the schools we deserve. We never get the health care we deserve. To gut things like Medicaid, come from Medicare and Social Security. That's how they intend to pay for that. And I think it is high past time we said enough is enough.
We are on track to spend more than $70 trillion on healthcare over the next decade. Just an enormous amount of money. The problem is not that Americans are using too much healthcare. The problem is that when we use healthcare, we pay much, much higher prices. Higher prices for doctor's visits, for hospital visits, for procedures, for pharmaceuticals. Everything costs more in America. Why is that? Well, fundamentally, prices are controlled by one of two things: effective market forces, where you have real competition, or when government puts caps on prices. In America, we have neither. So in my set of solutions, I basically want to give policymakers a set of options. If you're more market-oriented, block illegal mergers that give health systems too much market power. If you can't do that, or if the market is already super consolidated, bring in new competition. Bring in physician-owned hospitals, ambulatory surgical centers. Get rid of certificate of need laws which block competition. Those are market-based solutions, and that will resonate with some chunk of policymakers. Other policymakers, not as convinced about the market, still have their own solutions that they can implement. Price regulations, put caps on prices so that one health system that might have monopoly power can't charge whatever they want. Because when prices get out of control, all of us pay for that through higher insurance bills and higher out-of-pocket spending.
This was just a visit. There was no procedures done. They took my blood pressure. That's it.
America has become completely unaffordable, and I don't know why nobody's talking about this. Rent is insane. Half Americans don't even have savings. And something like a rhinoplasty or a hair transplant, 15 to 20K minimum.
Ever wonder what a miscarriage costs in America? Let's go over it. I've had 3. My first pregnancy loss was a ruptured ectopic pregnancy. $59,409.98. I am still dealing with the grief of my first pregnancy loss, but I am also still trying to settle that bill because my insurance is arguing with me that I could have gone to a different hospital where it would have been cheaper. Months later, I was pregnant again and had a missed miscarriage, and that surgery was $23,411.07. Last but not least, for my third pregnancy loss, so I feel like you have to laugh or you cry, I somehow managed to get a discounted rate of $18,241, bringing us to a grand total of $101,560.98.
Healthcare in the US is so cooked. I complained about hip pain once, and that put me out $2,000 because we got a couple of x-rays. I also went to a PT session where I learned how to do cat dog for $500. That was nice. And I also went to a preventative healthcare checkup where I thought it would be free, but because I mentioned a vitamin D deficiency in the past, that put me out $300. And this is all with health insurance.
I cannot tell you how obsessed I am with this chart. It shows exactly what is wrong with America's conversation about healthcare. On one level, you've seen this chart before. It shows healthcare spending as a share of the economy of a bunch of countries. There's Germany and France and Japan and Canada, and oh, there's America. But now I want to add something you haven't seen to this chart. This is how much of that spending in each country is private and how much is public. Here's what's amazing. America's government spending on healthcare, on programs like Medicaid and Medicare and the VA, our versions of socialized medicine, it's about the same size as these other countries. These countries where the government runs the whole healthcare system. And then there's our private spending. It's the private insurance system that makes healthcare in America so expensive. Conventional wisdom says the government is more expensive than the private sector. It can't say no, it's corrupt, it's inefficient, it's slow. You want something done right, you give it to the private sector. That is what we hear in America all the time.
Getting sick is stressful enough, but in America, for many people, the financial fear comes first. And as healthcare costs continue rising, more families are being pushed into debt just trying to stay healthy. Because in today's America, sometimes the treatment hurts your wallet more than the illness itself.